I'm Sheila Marie de la Cruz from BSN 1B, and today I'm going to perform a head-to-toe assessment. And these are the materials that I'm going to use. Then, I already performed hand washing and hand hygiene and observe appropriate infection prevention procedures. The next thing to do is to identify your patient, then explain your procedure to the patient. Also, provide privacy by closing the doors and the curtains and diminishing room noise. Now, let's proceed with the head-to-toe assessment. Hi, I'm Nurse De La Cruz and I will be your nursing assistant for today. So I'm going to conduct a head-to-toe assessment. So may I ask if it's okay if I proceed to the assessment? Okay. So the first thing I will do is to observe your appearance. So may you please stand up so I can observe your appearance, please. May you state your name, please?
De La Cruz, Shaila
How about your birthday?
June 23, 2003.
Can you please turn around so I can assess your body? Okay. Okay, sit down. So the next thing I will do is I will going to assess your vital signs. The first thing is I will take your blood pressure. Can you please put your arms here? Arm. Okay, so your blood pressure is 110/80, which is in normal range. So the next I will do is I'm going to assess your pulse rate. So can you please put your hands here? I'm going to count your pulse. Okay. The next thing I will do, I will going to assess your respiratory rate. Can you please put your hands on your chest? Going to count your respiratory rate. Okay. The next thing I will do, I'm going to check your temperature. So your temperature is normal. it's 37.3, meaning it's within the normal range. Now I'm going to assess my patient's height using this tape measure. So the next thing I will do is I'm going to assess your mental status. To start that, I want you to stand up so I can observe your posture and body movements. And you can turn around so I can observe. Okay. I'm going to assess your facial expression. So can you please smile or raise your eyebrows? Raise your eyebrows, okay. Okay, next, I'm going to assess your skin for its texture, color, or if there's any present blushes or lesions. Other hand. And your neck. The next, I'm going to assess your head and neck. So first, I'm going to palpate your head. Then I'm going to assess your hair. Okay. For assessing the patient's hair, you may use gloves to protect yourself from the patient because parasites or dandruffs might be present on the hair of the patient. Next, I'm going to observe your cranial nerve number 7. So I want you to show me facial expressions like smiling, raising your eyebrows. Can you please smile, raise your eyebrow. Okay. Then I'm going to assess your forehead, your cheek, and your chin for sensation. I'm going to palpate your forehead and your chin, cheek, then your chin. So now I'm putting on gloves because I'm going to assess the patient's eyes, ears, and mouth. So I'm going to assess your eyes. I'm going to check for any inflammations or irritation in the skin around the eye of the patient. You may use pen light for a better view on the patient's eyes. I'm going to test your vision or your visual acuity by using this Snellen chart and doing this procedure. Okay, next is your ears. I'm going to inspect your ears for any irritations again or inflammations. I'm going to use otoscope to inspect my patient's auditory canal and tympanic membrane. Let's say that this pen light will serve as my otoscope. Then, the next thing I would do is I'm going to test the hearing of the patient. I'm going to ask the hearing ability of the patient on both left and right ears. Now, I'm going to inspect my patient's nose and sinuses. To begin with, I'm going to inspect and palpate my patient's external nose or external part of the nose for tenderness. I'm going to palpate it. Next, I'm going to assess my patient's nose by letting her smell anything like soap, coffee, or vanilla. For this procedure, this is the sample that I will going to let my patient smell. Going now to assess my patient's mouth and throat. I'm still wearing my gloves and I'm going to inspect my patient's lips, my patient's teeth, same with her gums. I will also check the soft and hard palate of the patient. I will also observe her uvula. Okay. You can also again use pen light for better view. For observing the uvula, you can instruct the patient to say to observe the uvula of the patient. Say okay. So I also did assess my patient's gag reflex. The next thing I will do is I'm going to inspect my patient's tonsils again with the use of pen light. Then I'm going to palpate and inspect my patient's tongue using this tongue depressor. This will serve as my tongue depressor. Okay. So I'm going to remove now my gloves. Now I'm going to assess your neck. I'm going to inspect your neck. Okay. I'm going to palpate my patient's neck. I'm going also to palpate her thyroid gland and her trachea. I'm also going to assess my patient's range of motion, the range of motion of her neck. And now I'm going to assess your arms, hands, and fingers. I'm going to inspect and assess my patient's upper extremities. So now I'm going to assess my patient's reflexes. So this will serve as my reflex hammer. And now I'm going to inspect my patient's posterior and lateral chest. So for assessing my patient's heart, I'm going to inspect, palpate, and auscultate her heart. So now I'm going to assess my patient's abdomen. For this procedure, I'm going to assist my patient to lie down in a supine position. You can cover the patient and expose only the area you're going to assess, which is the patient's abdomen. I'm going to inspect, auscultate, percuss, and palpate my patient's abdomen. Then again, I'm going to assist my patient to be in a sitting position again. So now I'm going to assess my patient's legs, feet, and toes. I'm going to observe her legs, feet, and toes. I'm also going to palpate her legs and feet. I'm also going to palpate her knees. And I'm going to assess for capillary refill. And next, I'm going to again assist my patient to be in a supine position to assess and to perform heel to shin test. So the next procedure I will do, I'm going to assess my patient's musculoskeletal and urologic system.